Every single day, your body may be silently warning you of kidney failure, and you might not even notice. It starts small: a little fatigue, a change in how often you go to the bathroom, maybe some swelling in your legs. But beneath these subtle symptoms, something dangerous could be brewing in your bloodstream: elevated creatinine levels. Creatinine isn't just a number on your lab results. It's a red flag. A toxic waste product that your muscles produce every day, and your kidneys are supposed to eliminate. But what happens when they can't keep up? The answer is alarming. Over 850 million people worldwide suffer from kidney disease, and the vast majority don't even know it. According to the National Kidney Foundation, 9 out of 10 people with stage 3 chronic kidney disease are unaware they have it. And high creatinine is often the first clue. Unchecked, this buildup can cause fluid overload, nerve damage, heart failure, and eventually, complete kidney shutdown. That's why recognizing the symptoms early isn't just important, it could save your life. In this video, we'll uncover 13 warning signs your body might be giving you right now, all backed by scientific research. Some are obvious. Others are so subtle, you'd never connect them to your kidneys. But knowing them could mean the difference between early intervention and irreversible damage. Your health isn't just about how you feel, it's about what your body is trying to tell you. Let's decode those signals together. 1. Chest pain and heart palpitations. Let's begin with a lesser-known but critical symptom of elevated creatinine levels: chest pain and heart palpitations. It starts as a small discomfort, maybe a tightness in your chest or an unusual flutter in your heartbeat. You brush it off, thinking it's just stress or too much caffeine. But then it happens again and again. What if the real reason is something you wouldn't expect: your kidneys? High creatinine levels, a sign of kidney trouble, can silently strain your heart. When the kidneys aren't filtering waste properly, excess fluid builds up in the body, putting pressure on the heart. At the same time, imbalanced electrolytes like potassium and sodium can disrupt the heart's rhythm, leading to palpitations or even chest pain. It's not just about the kidneys, your whole body feels the impact. A study published in the Journal of the American Society of Nephrology found that even slight increases in serum creatinine levels are linked to a higher risk of cardiovascular events, including heart attacks and strokes. This highlights the deep connection between kidney function and heart health. If you've noticed these symptoms along with high creatinine levels, don't ignore them. Your body is signaling that something needs attention. A doctor can check both your kidney and heart health to get to the root of the problem. 2. Trouble sleeping. Another early indicator of elevated creatinine levels is trouble sleeping. Experiencing trouble sleeping can be a symptom of elevated creatinine levels, often indicating compromised kidney function. When kidneys aren't filtering waste effectively, toxins accumulate in the blood, leading to discomfort and sleep disturbances. This buildup can result in symptoms like muscle cramps, restless leg syndrome, and itching, all of which interfere with a restful night's sleep. A 2024 study published in Renal Failure found that insomnia and short sleep duration increase the risk of elevated serum creatinine. This suggests a bidirectional relationship where poor sleep can both result from and contribute to declining kidney function. Additionally, sleep apnea is more prevalent among individuals with chronic kidney disease. The frequent interruptions in breathing characteristic of sleep apnea can lead to fragmented sleep and reduced oxygen levels, further straining kidney function. Addressing sleep issues is crucial, as improving sleep quality may help in managing elevated creatinine levels and overall kidney health. 3. Metallic taste in mouth and bad breath. Moving on, You might not associate a strange taste or bad breath with kidney health, but they can signal rising creatinine levels. Elevated creatinine levels often signal impaired kidney function, leading to the accumulation of waste products in the blood, a condition known as uremia. This buildup can manifest as a metallic taste in the mouth and bad breath. When kidneys aren't filtering efficiently, urea accumulates and breaks down into ammonia, imparting an unpleasant taste and odor. A study published in the Journal of Oral Nutrition in 2024 highlighted that approximately 35% of end-stage renal disease patients experience dysgeusia, or altered taste perception. This alteration often leads to decreased appetite and nutritional challenges. Additionally, research indicates that elevated salivary levels of creatinine and urea in chronic kidney disease patients can contribute to dry mouth and uremic breath. These changes further exacerbate the metallic taste and bad breath associated with high creatinine levels. It's essential to recognize these oral symptoms as potential indicators of declining kidney function. If you're experiencing a persistent metallic taste or bad breath, consulting a healthcare professional is advisable to assess kidney health and address any underlying issues. 4. Headaches. Another symptom that might surprise you is persistent headaches caused by high creatinine levels. Neurological complications emerge as silent messengers when kidney function deteriorates. High creatinine levels trigger a cascade of metabolic disruptions that directly impact brain chemistry, manifesting as persistent headaches. Groundbreaking research from clinical pharmacology and therapeutics reveals that elevated creatinine concentrations create neurotoxic environments. Accumulated waste products interfere with neural signaling, causing inflammatory responses that stimulate pain receptors in the cerebral cortex. Metabolic imbalances associated with compromised kidney function disrupt electrolyte homeostasis. Sodium and potassium levels become destabilized, generating neurological strain that directly contributes to vascular tension and consequent headache manifestations. These biochemical alterations create intricate neurological stress mechanisms. Inflammatory cytokines released during kidney dysfunction penetrate the blood-brain barrier, triggering neuroinflammatory responses. This complex physiological mechanism explains why individuals experiencing high creatinine levels often report recurrent intense headaches that resist traditional pain management strategies. The body's sophisticated communication system transforms headaches into critical warning signals, demanding comprehensive medical evaluation and immediate intervention to address underlying kidney dysfunction. 5. Loss of appetite and weight loss. When high creatinine levels affect metabolism, the result can be a loss of appetite and unintentional weight loss. Metabolic disruptions create a complex cascade of physiological changes. When creatinine levels escalate beyond normal ranges, your body becomes an intricate warning system, signaling distress through nuanced symptoms like diminished appetite and unexpected weight loss. Kidney function plays a pivotal role in this metabolic mystery. The nephrology dialysis transplantation, 2015, revealed that elevated creatinine levels trigger pro-inflammatory cytokines, which dramatically suppress appetite-regulating hormones. These molecular mechanisms demonstrate how metabolic stress disrupts ghrelin and leptin, crucial hormones controlling hunger signals. Protein catabolism accelerates, causing muscle tissue breakdown and consequent unintentional weight reduction. This metabolic recalibration represents your body's sophisticated survival strategy during compromised kidney function. Biochemical investigations highlight how accumulated waste products interfere with digestive enzyme production, creating an environment where nutrient absorption becomes challenging. Metabolic disturbances manifest through complex neuroendocrine pathways. the hypothalamic pituitary adrenal axis becomes dysregulated, creating neurochemical imbalances that directly suppress appetite centers in the brain. These symptoms aren't mere coincidences but sophisticated biological responses signaling underlying renal challenges, urging immediate medical attention and comprehensive diagnostic evaluation. Your body communicates through these nuanced metabolic alterations, demanding careful interpretation and professional medical insight. 6. Persistent itching. If you're constantly scratching without a clear reason, it might be linked to high creatinine levels. Persistent itching, medically known as pruritus, is a common symptom among individuals with elevated creatinine levels, often indicating compromised kidney function. This itching, referred to as uremic pruritus, can significantly impact one's quality of life. Why does this itching occur? When kidneys aren't functioning properly, waste products like urea accumulate in the blood, a condition termed uremia. This buildup is believed to trigger itching sensations. Additionally, imbalances in electrolytes, such as increased phosphorus levels, can exacerbate the itchiness. Dry skin, common in kidney disease patients due to reduced sweat and oil gland activity, further contributes to the discomfort. Recent research has shed light on this issue. A study published in the Clinical Kidney Journal in 2023 highlighted that up to 70% of dialysis patients experience pruritus, underscoring its prevalence and the need for effective management strategies. Understanding the connection between high creatinine levels and persistent itching emphasizes the importance of monitoring kidney health and seeking appropriate care to manage symptoms effectively. 7. High blood pressure. A commonly overlooked consequence of rising creatinine is high blood pressure. Elevated creatinine levels often signal impaired kidney function, which can lead to high blood pressure or hypertension. When kidneys aren't filtering blood efficiently, excess fluid and sodium accumulate in the bloodstream. This increase in fluid volume raises blood pressure. Additionally, compromised kidneys may overactivate the renin-angiotensin-aldosterone system, or RAAS, a hormonal pathway that regulates blood pressure. Overactivation of RAAS causes blood vessels to constrict and prompts the body to retain sodium and water, further elevating blood pressure. A study published in the Journal of Hypertension in 2022 found that higher plasma creatinine concentrations are associated with an increased risk of developing hypertension in men. This underscores the link between kidney function and blood pressure regulation. In summary, elevated creatinine levels can indicate kidney dysfunction leading to fluid retention and hormonal imbalances that raise blood pressure. Recognizing this connection is vital for early intervention and effective management of both kidney health and hypertension. 8. Muscle cramps and twitching. Have you ever been jolted awake by a sudden leg cramp or experienced unexplained muscle twitching during the day? While these sensations may seem harmless or merely annoying, they could be your body's way of pointing to a deeper issue: elevated creatinine linked to impaired kidney function. As your kidneys begin to lose their efficiency, one of the earliest consequences is a disruption in your body's electrolyte equilibrium. Potassium and calcium, two minerals vital for smooth muscle contraction, can become unbalanced when waste filtration slows down. This instability sets the stage for involuntary muscle spasms, cramps, and persistent twitching that may catch you off guard at any time. Medical evidence backs this connection. A 2016 study published in Nephrologia documented that patients with elevated serum creatinine frequently reported muscle cramps, with the primary culprit being altered calcium regulation caused by poor kidney filtration. The muscles, deprived of proper chemical signaling, begin to misfire. So if you're finding yourself battling more cramps than usual, especially if you've been told your creatinine levels are high. It's time to pay attention. Consulting a healthcare provider can help determine whether your kidneys are at the root of these discomforts, and guide you towards strategies that restore both muscle control and metabolic balance. 9. Nausea and vomiting. If you've been experiencing frequent bouts of nausea or find yourself vomiting without an obvious cause, your kidneys might be trying to send you a warning. As creatinine levels rise due to declining kidney function, the buildup of metabolic waste in your bloodstream leads to a toxic state known as uremia. This toxic overload doesn't just affect your kidneys, it irritates the lining of your digestive tract, which can trigger intense nausea and episodes of vomiting. But the problem doesn't stop there. When kidney function drops, it also throws your body's delicate electrolyte balance off track. Elevated potassium levels, which are common in kidney impairment, can further intensify digestive distress and make recovery harder without proper intervention. The link between these symptoms and kidney disease isn't just anecdotal. A 2022 study published in Kidney International Reports found a strong association between high urea levels and gastrointestinal issues like nausea and vomiting in patients with advanced kidney dysfunction. This reinforces how vital it is to treat such symptoms as possible signs of systemic imbalance rather than isolated stomach problems. If persistent nausea or vomiting is disrupting your daily life, especially in the context of known or suspected kidney issues, it's more than just a digestive concern. Timely consultation with a healthcare provider is essential to uncover the underlying cause and prevent further health deterioration. 10. Shortness of breath. Another critical symptom of impaired kidney function is shortness of breath, which may stem from high creatinine levels. Kidneys play a crucial role in filtering waste, but when they lose efficiency, toxins like creatinine start building up in the blood. This buildup often leads to fluid retention. As the kidneys struggle to balance fluid levels, excess fluid can accumulate in various parts of the body, including the lungs, a condition known as pulmonary edema. This fluid in the lungs makes it challenging to breathe, resulting in shortness of breath. A 2023 study published in Physical Activity and Nutrition examined the relationship between kidney function and lung health. The researchers found that individuals with elevated serum creatinine levels had a higher likelihood of experiencing restrictive and obstructive pulmonary conditions, both of which can manifest as breathing difficulties. Furthermore, impaired kidney function can lead to anemia, a deficiency in red blood cells responsible for transporting oxygen throughout the body. With fewer red blood cells, oxygen delivery decreases, causing symptoms like fatigue and shortness of breath. This means that even routine activities can become exhausting as the body struggles to meet its oxygen demands. If you're noticing unexplained shortness of breath, especially alongside other signs like swelling or fatigue, it's essential to consult a healthcare professional. These symptoms could indicate underlying kidney issues that need prompt attention. 11. Decreased urine output. Have you noticed your trips to the bathroom becoming less frequent, with smaller amounts of urine than usual? This seemingly minor change could be your body's way of alerting you to a more serious issue: impaired kidney function. When the kidneys begin to falter, their ability to filter waste from the blood is compromised. As a result, creatinine and other toxins accumulate, leading to a noticeable decline in urine output, what doctors refer to as oliguria. This reduction in urinary flow is not just a random fluctuation. It's often among the earliest indicators that your kidneys are under stress. As filtration slows down, waste and fluids that should have been expelled remain in your system, contributing to internal buildup and further strain on your organs. Groundbreaking findings published in Nature Reviews Disease Primers in 2021 reported that Oliguria is a frequent symptom in patients experiencing acute kidney injury, AKI, and it strongly correlates with elevated serum creatinine levels. This makes monitoring your urine output not just helpful, but essential for catching kidney problems before they escalate. If you find yourself urinating significantly less than usual, especially if accompanied by other warning signs, don't delay seeking medical evaluation. Prompt attention could make all the difference in preserving kidney health and preventing long-term damage. 12. Swelling. Visible symptoms such as swelling may be another clear indication of elevated creatinine. Imagine waking up to find your shoes fitting tighter than usual or noticing puffiness around your ankles. This swelling, known as edema, can be more than just a minor inconvenience. It might signal elevated creatinine levels indicating kidney issues. When kidneys struggle, they can't efficiently remove excess sodium and water from your body. This retention leads to fluid accumulation in tissues, causing noticeable swelling, especially in areas like the legs, ankles, and face. This isn't just about appearance, it's your body's way of signaling that something's amiss with your kidney function. A study published in Curious in 2022 highlighted that individuals with chronic kidney disease often experience edema due to this sodium and water retention. The research emphasized that managing salt intake and monitoring fluid balance are crucial steps in alleviating this swelling and preventing further complications. Beyond the visible puffiness, edema can lead to discomfort and mobility issues. Simple activities like walking or wearing regular footwear might become challenging. Moreover, if fluid accumulates in the lungs, a condition known as pulmonary edema, it can result in breathing difficulties, making daily tasks daunting. It's essential to pay attention to these signs. If you notice persistent swelling, especially when accompanied by other symptoms like fatigue or changes in urination, consulting a healthcare professional is vital. Early detection and management can make a significant difference in maintaining your health and quality of life. 13. Fatigue and weakness. Finally, the most common and often overlooked symptom of high creatinine is fatigue and weakness. When your kidneys aren't working properly, waste products like creatinine can build up in your blood. This accumulation can make you feel unusually tired and weak. Essentially, your body is carrying around extra waste it can't get rid of, which can sap your energy. A study in the Clinical Journal of the American Society of Nephrology found that about 70% of people with chronic kidney disease experience fatigue, with up to 25% reporting severe symptoms. This shows how common and impactful this tiredness can be. Additionally, when kidneys fail to filter properly, toxins accumulate in the blood, leading to a condition called uremia. This can cause symptoms like fatigue, weakness, and confusion. If you're feeling persistently tired and weak, it's essential to consult a healthcare professional. They can perform tests to check your kidney function and determine if high creatinine levels are the cause. Early detection and management are crucial in preventing further complications. Your kidneys don't have a loud voice, but they do speak. Through fatigue, swelling, shortness of breath, nausea, and even the way your skin itches or your breath smells, they are constantly signaling when something's wrong. Ignoring these signs doesn't just risk your kidneys, it endangers your heart, your brain, and your life. The good news? Awareness is power. Every symptom we discussed today is your opportunity to intervene early, seek help, and prevent irreversible damage. By recognizing these red flags and acting on them, you're not only protecting your kidney function, you're preserving your future health and independence. If you found this video helpful, don't keep it to yourself, share it with someone who might need it. There are millions who are living with silent kidney issues without knowing the truth. And if you want more science-backed health insights like this, delivered clearly, compassionately, and always with your well-being in mind, hit the like button, subscribe to our channel, and turn on the notification bell so you never miss an important update. Take care of your kidneys. They take care of you, quietly, every single day. Let's keep them strong, together. See you in the next video.